Aloha, this is Dr. Bibuti. I will be discussing major depressive disorder today. Please stay with me. Your doctor may determine a diagnosis of depression based on physical exam. Your doctor may do a physical exam and ask questions about your health. In some cases, depression may be linked to an underlying physical health problem. Lab tests. For example, your doctor may do a blood test called a complete blood count or test your thyroid to make sure it's functioning properly. Psychiatric evaluation. Your mental health professional asks about your symptoms, thoughts, feelings, and behavior patterns. You may be asked to fill out a questionnaire to help answer these questions. DSM 5. Your mental health professional may use the criteria for depression listed in the Diagnostic and Statistical Manual of Mental Disorders, DSM 5, published by the American Psychiatric Association. Types of depression. Symptoms caused by major depression can vary from person to person. To clarify the type of depression you have, your doctor may add one or more specifiers. A specifier means that you have depression with specific features, such as anxious distress, depression with unusual restlessness, or worry about possible events or loss of control, mixed features, simultaneous depression and mania, which includes elevated self-esteem, talking too much, and increased energy, melancholic features, severe depression with lack of response to something that used to bring pleasure and associated with early morning awakening, worsened mood in the morning, major changes in appetite, and feelings of guilt, agitation, or sluggishness. Atypical features: depression that includes the ability to temporarily be cheered by happy events, increased appetite, excessive need for sleep, sensitivity to rejection, and a heavy feeling in the arms or legs. Psychotic features: depression, accompanied by delusions or hallucinations, which may involve personal inadequacy or other negative themes, catatonia. Depression that includes motor activity that involves either uncontrollable and purposeless movement or fixed and inflexible posture, peripartum onset, depression that occurs during pregnancy or in the weeks or months after delivery, postpartum, seasonal pattern, depression related to changes in seasons and reduced exposure to sunlight. Other disorders that cause depression symptoms. Several other disorders, such as those below, include depression as a symptom. It's important to get an accurate diagnosis so you can get appropriate treatment. Bipolar I and TWI disorders. These mood disorders include mood swings that range from highs, mania, to lows, depression. It's sometimes difficult to distinguish between bipolar disorder and depression. Cyclothymic disorder. Cyclothymic disorder involves highs and lows that are milder than those of bipolar disorder. Disruptive mood dysregulation disorder. This mood disorder in children includes chronic and severe irritability and anger with frequent extreme temper outbursts. This disorder typically develops into depressive disorder or anxiety disorder during the teen years or adulthood. Persistent depressive disorder, sometimes called dysthymia. This is a less severe but more chronic form of depression. While it's usually not disabling, persistent depressive disorder can prevent you from functioning normally in your daily routine and from living life to its fullest. Premenstrual dysphoric disorder. This involves depression symptoms associated with hormone changes that begin a week before and improve within a few days after the onset of your period and are minimal or gone after completion of your period. Other depression disorders. This includes depression that's caused by the use of recreational drugs, some prescribed medications, or another medical condition. Treatment medications and psychotherapy are effective for most people with depression. Your primary care doctor or psychiatrist can prescribe medications to relieve symptoms. However, many people with depression also benefit from seeing a psychiatrist, psychologist, or other mental health professional. If you have severe depression, you may need a hospital stay, or you may need to participate in an outpatient treatment program until your symptoms improve. Here's a closer look at depression treatment options. Medications. Many types of antidepressants are available, including those below. Be sure to discuss possible major side effects with your doctor or pharmacist. Selective serotonin reuptake inhibitors, SSRIs. Doctors often start by prescribing an SSRI. These drugs are considered safer and generally cause fewer bothersome side effects than other types of antidepressants. SSRIs include citalopram, Celexa, escitalopram, Lexapro, fluoxetine, Prozac, paroxetine, Paxil, Pexiva, sertraline, Zoloft, and Vilazodone, Vibraid, serotonin, norepinephrine reuptake inhibitors, SNRIs, Examples of SNRIs include duloxetine, Cymbalta, venlafaxine, Effexor XR, desvenlafaxine, Pristique, Kidesla, and levomilnacipran, Fitsima. Atypical antidepressants. These medications don't fit neatly into any of the other antidepressant categories. They include bupropion, Wellbutrin XL, Wellbutrin SR, Aplenzin, Forfivo XL, mirtazapine, Remeron, Nefazodone, Trazodone, and vortioxetine, Trintelix. Tricyclic antidepressants. These drugs, such as imipramine, tofranil, nortriptyline, Pamelor, amitriptyline, doxepin, trimipramine, Sermentil, desipramine, norpramin, and protriptyline, Vivactil, can be very effective but tend to cause more severe side effects than newer antidepressants. So tricyclics generally aren't prescribed unless you've tried an SSRI first without improvement. Monoamine oxidase inhibitors, MAOIs. MAOIs, such as tranylcypromane, Parnate, phenelzine, Nardil, and isocarboxazid, Marplan, may be prescribed, typically when other drugs haven't worked, because they can have serious side effects. Using MAOIs requires a strict diet because of dangerous or even deadly interactions with foods, such as certain cheeses, pickles, and wines, and some medications and herbal supplements. Selegiline, MSAM, a newer MAOI that sticks on the skin as a patch, may cause fewer side effects than other MAOIs do. These medications can't be combined with SSRIs. Other medications. Other medications may be added to an antidepressant to enhance antidepressant effects. Your doctor may recommend combining two antidepressants or adding medications such as mood stabilizers or antipsychotics. Anti anxiety and stimulant medications also may be added for short term use. Finding the right medication. If a family member has responded well to an antidepressant, it may be one that could help you. Or you may need to try several medications or a combination of medications before you find one that works. This requires patience, as some medications need several weeks or longer to take full effect, and for side effects to ease as your body adjusts. Inherited traits play a role in how antidepressants affect you. In some cases, where available, results of genetic tests done by a blood test or cheek swab may offer clues about how your body may respond to a particular antidepressant. However, other variables besides genetics can affect your response to medication. Risks of abruptly stopping medication. Don't stop taking an antidepressant without talking to your doctor first. Antidepressants aren't considered addictive, but sometimes physical dependence, which is different from addiction, can occur. Stopping treatment abruptly or missing several doses can cause withdrawal like symptoms, and quitting suddenly may cause a sudden worsening of depression. Work with your doctor to gradually and safely decrease your dose. Antidepressants and pregnancy. If you're pregnant or breastfeeding, some antidepressants may pose an increased health risk to your unborn child or nursing child. Talk with your doctor if you become pregnant or you're planning to become pregnant. Antidepressants and increased suicide risk. Most antidepressants are generally safe, but the Food and Drug Administration, FDA, requires all antidepressants to carry a black box warning, the strictest warning for prescriptions. In some cases, children, teenagers, and young adults under age 25 may have an increase in suicidal thoughts or behavior when taking antidepressants, especially in the first few weeks after starting or when the dose is changed. Anyone taking an antidepressant should be watched closely for worsening depression or unusual behavior, especially when starting a new medication or with a change in dosage. If you or someone you know has suicidal thoughts when taking an antidepressant, immediately contact a doctor or get emergency help. Keep in mind that antidepressants are more likely to reduce suicide risk in the long run by improving mood. Psychotherapy. Psychotherapy is a general term for treating depression by talking about your condition and related issues with a mental health professional. Psychotherapy is also known as talk therapy or psychological therapy. Different types of psychotherapy can be effective for depression, such as cognitive behavioral therapy or interpersonal therapy. Your mental health professional may also recommend other types of therapies. Psychotherapy can help you adjust to a crisis or other current difficulty, identify negative beliefs and behaviors, and replace them with healthy, positive ones, explore relationships and experiences, and develop positive interactions with others. Find better ways to cope and solve problems, identify issues that contribute to your depression, and change behaviors that make it worse. Regain a sense of satisfaction and control in your life and help ease depression symptoms such as hopelessness and anger. Learn to set realistic goals for your life. Develop the ability to tolerate and accept distress using healthier behaviors. Alternate formats for therapy. Formats for depression therapy as an alternative to face office sessions are available and may be an effective option for some people. Therapy can be provided, for example, as a computer program, by online sessions, or using videos or workbooks. Programs can be guided by a therapist or be partially or totally independent. Before you choose one of these options, discuss these formats with your therapist to determine if they may be helpful for you. Also, ask your therapist if he or she can recommend a trusted source or program. Some may not be covered by your insurance, and not all developers and online therapists have the proper credentials or training. Smartphones and tablets that offer mobile health apps, such as support and general education about depression, are not a substitute for seeing your doctor or therapist. Hospital and residential treatment. In some people, depression is so severe that a hospital stay is needed. This may be necessary if you can't care for yourself properly or when you're in immediate danger of harming yourself or someone else. Psychiatric treatment at a hospital can help keep you calm and safe until your mood improves. Partial hospitalization or day treatment programs also may help some people. These programs provide the outpatient support and counseling needed to get symptoms under control. Other treatment options. For some people, other procedures, sometimes called brain stimulation therapies, may be suggested. Electroconvulsive therapy, ECT. In ECT, electrical currents are passed through the brain to impact the function and effect of neurotransmitters in your brain to relieve depression. ECT is usually used for people who don't get better with medications, can't take antidepressants for health reasons, or are at high risk of suicide. Transcranial magnetic stimulation, TMS. TMS may be an option for those who haven't responded to antidepressants. During TMS, a treatment coil placed against your scalp sends brief magnetic pulses to stimulate nerve cells in your brain that are involved in mood regulation and depression.